Thank you for being here. And this is a different conference without Jerry and Dan. One thing that is the same, though, is the quality and rigor of the scientific program, as well as a tremendous effort that HEI staff have put into organizing this research showcase. Specifically, I'd like to thank Dan Krause and Robert Shavers for their efforts in organizing the logistics for this conference. And we have record attendance. It's just incredible to see you all here. All of our staff are amazing, though. Over the next couple of days, I really hope that you find the opportunity to chat with some of our staff. And as true of many of you, I think you'll find that they are multidimensional in their interests and activities. In addition to the incredible work that they do in managing our robust scientific portfolio, they play in symphonies, they build boats, they are moms and dads, they rock climb, they ice swim, they travel the world on adventure, and most of all, they are kind and thoughtful individuals who care about their fellow colleagues and society at large. They also care about pursuing HEI's mission, which is to provide impartial science to inform decisions that foster a healthier environment and better health for all. And I can say that much of the same about our board members and our committee members and our sponsors. And in fact, one of the biggest reasons that I feel so fortunate to be in my role here at HEI is that there's really no other organization quite like HEI. We have the benefit of working with the top scientific minds across disciplines, across sectors, and across issues to address critical research needs related to health effects of air pollution. We have a strong and robust and interactive program over the next couple of days that will address wide-ranging themes such as optimization of research to support policy development, implications for human health within the energy transition, and health and air quality effects of goods movement in a changing landscape. We're also presenting the incredible vision for our collective work in the years ahead for 2025 to 2030. Fresh ideas that were curated from our many discussions with you over the last year. The key programmatic priorities include environment and health, environment, energy and health, global health initiatives, all with a thought and knitted together with environmental justice principles as part of that. You'll hear about all of these programs in various sessions over the next couple of days. You also hear a little bit about the city that's hosting us. We wanted to try something a little bit new this year to bring you a sense of the community here in Philadelphia. So we have the speaker tonight, Jane Golden from Mural Arts Philadelphia. We have a lot to cover, so I'm going to turn it over to Dr. Greg Wellenius, who's going to lead our first session on what does the changing climate mean for air quality and public health planning and exposure mitigation. Thank you.
Okay, thank you, and welcome all to the conference. And let me introduce my co-chair and friend and colleague, Sara Adar from the University of Michigan. So we'll be co-chairing this session together. And let me just jump right into it. There's been, in the US and across high-income countries around the world, there's been huge improvements in air quality over the last several decades, and that's brought really important health benefits. You can see there on the right, this is data from the State of the Global Air, which if you're not familiar with this resource, it's a resource put out by HEI and incredibly valuable in visualizing exactly like this and any other way you want to look at the data on air pollution and its health impacts. And so these improvements, of course, are not broadly shared equally across the world. There's many parts of the world where air pollution and the health impacts of air pollution are getting worse. But we do have these important gains, and it's important to realize that. And in parallel, it's important to realize that the these gains are now being threatened by in the context of a continually changing climate. This is probably in this audience is not a controversial idea, but the climate is warming. It's warming rapidly. 2023 was the warmest year on record, and in fact, the last 10 warmest years on record have occurred in the last decade. The 2005 was at the time the warmest year on record, and that is now the 12th warmest year on record. So just to give a sense of the accelerating pace of climate change. And of course, climate change, there's quite a bit now written and studied on the health impacts of climate change. So this isn't an environmental problem. This is a threat and a challenge to human health because we all have to live on this planet. And so I won't go into details of all the ways in which climate change impacts our health, but I want to make two quick points. One is that there are, in fact, there is increasing recognition of the importance of this issue. There's increasing funding available to study this issue and investments for building resilience and helping communities adapt to the continuing threat of climate change. Much, much more is needed. The funds available today pale in comparison to what is needed to actually advance the agenda, but I want to recognize the very real efforts of a number of organizations in the US and across the world. In the US, this is a focus area of the National Institutes of Health. And one important step in that is the funding of a research coordinating center called CAFE that's run jointly between the Boston University School of Public Health and the Harvard T.H. Chan School of Public Health, co-led by me, Dr. Amruta Nori Sarma, and Dr. Francesca Dominici. Francesca's at Harvard, of course, and if you're not already plugged into this community, I encourage you to do so. And this is also a key part of HEI's draft strategic research plan. This has been emailed to all conference registrants. If you haven't had a chance to look at it yet, I really encourage you to do so and provide feedback to HEI. And this is a recognition that these gains in air quality and the reductions in the health impacts of air pollution are being threatened because of the shifting context in which this occurs. And as has been alluded to before, these hazards are not independent. These are, so if you think of air pollution as a hazard, it's highly dependent on the contextual factors. And these interactions between these determinants of risk, so we put risk of human health impacts at the intersection of hazards, vulnerability, exposures, and the response. And the interactions amongst these four determinants, within them and between them, is actually really complicated and worthy of further study so we can learn to properly prepare and adapt to that. And consistent with that draft strategic plan and with this framing, today I look forward to a great session with some distinguished panelists to start to have a conversation around how is the shifting climate impacting air quality and the gains in air quality and health. And with that, I'd like to welcome our first speaker, who's Vijendra Ingole. He is an environmental epidemiologist and principal data science in climate and health at the Office of National Statistics in the UK. Vijendra.
Thank you, Georgie, for the kind introduction, and good afternoon, everyone. So I'm going to talk a little bit more about the climate change scenarios and what exactly it means for air quality and health. So going from some of the graphical representation which was shown earlier on what are the different PM2.5 levels actually mean for the health outcome in terms of 3 different settings, particularly low, middle, and high income countries. We often see in this image and always separate climate and air quality, but they are actually quite strongly interconnected. The recent comment from the Nature Medicine comes up with after almost 2000, year 2000, this 2024 will be the 4 million deaths attributable to climate change in less than 2 decades. So thinking not as a separate issue, but as a combined issue in order to strengthen our environments, will help to mitigate climates and most importantly, public health. We have seen this climate impact on human health with different sources, which particularly linking on the direct impact of climate on human health, and very less focus, particularly thinking from the less developed countries, what are the underlying demographic, socioeconomics, and environmental factors are associated. For this purpose, we also linking some of these aspects in terms of the air quality and its impact on health, thinking that how the climate change changing over a period of times leads to increase in the global heat waves, leads to increase in air pollution and number of different health outcome, including more recently on mental health. So I'm not going to go to details on the physiological mechanism, but just giving some sort of a more global perspective, like what are the different global change scenarios and policy mitigation actions we take today will benefit tomorrow or in near future. So climate community has already developed these scenarios, which is called RCPs and SSPs, which are the shared socioeconomic pathways. And we have 5 different pathways and 4 different RCPs. So in order to combine those 5 different aspects of SSPs and RCPs, we develop, I will go to details later then on the what are these SSPs. So mostly the SSP1 and SSP5 is more sort of a sustainability and fossil fuel development, and SSP3 and 4 is more like an unequal world, and SSP2 is more a middle of the road. In order to combine both the aspects of SSPs and RCPs to do some integrated analysis, we define based on these 2 different climate change scenario and define this framework. And practically SSP1 and 8.5 is not possible. So we have only concluded 9 different scenarios in order to understand this global climate change scenario, actually how it works on the local population. I mean local population is at less than city level and up to the village level and so on. So in order to conduct this analysis, this modeling framework has been used, and obviously global climate change scenario we cannot directly use to the local population and local phenomena. So for that purpose, we have used the GCAM and TEM fast model in order to extract and project what will be the PM 2.5 level in near future, and then use some of the local mortality rates from the local communities and measure also PM 2.5 from those villages and towns and cities in 3 different countries. So in this particular example, I wanted to focus on showcasing what will be the future attributable deaths among 3 different case studies. So here we have 5 different colors with 5 different SSPs, which is combined with 2 mitigation scenario, RCP 2.6 and RCP 8.5. And here we can see consistently the combination of SSP1 and SSP5 leads to less or decreasing number of deaths according to, despite there are underlying changes in each scenario is different, still it leads to less number of PM attributable deaths among those SSP1 and SSP5 scenarios in combination with RCP 2.6. However, in reverse case, if we looked at unequal world SSP3 and SSP4, we can see clearly that there is a huge burden of diseases among these 2. With respect to the no demographic change with the same population, which clearly demonstrate again these 2 aspects of the SSPs and RCP combination 1 and 5 leads to less number of deaths in those countries. So there are 3 key main messages I wanted to highlight here, that whatever the social development scenarios at global scale is directly impacting the local mortality at very local level, at village level and city level and so on. The SSP 3 and 4 is more sort of an unequal world, leads to consistently high burden of PM 2.5 attributable deaths in those settings. And with respect to the data, which we have a limitation, and also I will talk about in next slides, some of the research gaps we identify from this research, and also the importance of socioeconomic development in those aspects. So we have seen number of exposure response functions and those epidemiological studies which highlighted using the global burden of disease and health impact assessment and so on. However, there has been recently the WHO guideline which talks about the new standards of the PM 2.5 and other air pollutants, which needs to be reevaluated and see whatever the estimates we have done earlier was underestimating, and actually to look more closely on those exposure response functions, thinking, and also the social inequalities, thinking not only from the high income country or low income country, but within the countries and within the communities and within the cities, there is a huge number of gaps in research with respect to social inequalities. And also I wanted to just end up with the some of the data and research gap. So currently working with Office for National Statistics in collaboration with some of the national statistics offices in Africa, particularly in Ghana and Rwanda, in order to fill those gaps by developing the framework for the health impact assessment, not only focusing on air pollution, but other different climatic indicators, and also showcasing the knowledge sharing platform where national stat offices could go and report those annual number of climatic events and their impact on human health. So with that, I really would like to thank you once again to the panel and also the HEI for giving me this opportunity to discuss some of my previous research, and thank you for those who supported this research. Thank you very much.
Thank you so much. Okay, wonderful. Thank you so much for that very interesting presentation. Next up, we have Dr. Kelp, who is a NOAA Climate and Global Change postdoctoral scholar up at Stanford University, who will be talking to us about fires, air quality and health, connections between air quality management, public health messaging, and personal interventions. Welcome, Dr. Kelp.
Great. Thanks so much for the invitation. So let's try to do fires in 8 minutes here. So I start by saying that fires are really an integral part of our Earth system, right? In many ways, fires at a high level have 3 ingredients, one being weather and climate, another being fuels, and another being ignition, of which humanity is really influencing all 3 of these inputs. So, you know, in terms of climate, due to advents of a global warming scenario, that we're having increased incidences of drought, which then leads to the greater potential for more fires. We're seeing this kind of all over the Western United States, all over the world, basically. But humans themselves impose a really strong control on fire, both in terms of suppression and ignition. In the Western United States, we've had this 100-year legacy of fire suppression, that the policy has been, as soon as a fire kind of sprouts up, we immediately dampen it out. And that has led to this huge overgrowth of fuels that we see in the West, which then create these mega fires. But also, humans cause 80% of the fires in the United States as well. So we're really altering this system in a very strong way. And in terms of the impacts of fires, we know that there's this large-scale degradation of air quality, which affects public health, which I'll talk about in the next slide, and also that of the carbon cycle as well, where we're now transforming these really historical carbon sinks into sources, especially that we're seeing this in the Amazon forests and in boreal regions in North America and in Europe as well. And really recent literature is suggesting now that wildfire smoke PM 2.5 may be actually more toxic than equal doses of ambient PM 2.5. This is because fires burn largely organic carbon sources. Then we volatilize that into the aerosol phase. These kind of organic carbon found in PM2.5 is linked to higher rates of incidences of cancer than its kind of inorganic counterparts. And also, fires burn down a lot of human-built structures, such as houses, that have a ton of these nasty heavy metals going from lead, mercury, to cadmium. A lot of this is not really fully characterized yet. This is pretty kind of new in terms of the health PM2.5 literature, and maybe there are people in the audiences who know better than me about this. And I want to highlight several case studies here, looking at fire not just in the United States, but kind of across the world. So agricultural fires in India are really leading to some of the world's worst air pollution. This is work by one of my colleagues, Tina Liu, who's a postdoc at UC Irvine and worked a lot on agricultural fires in India. We know that in India, there are 2 large growing phases of planting wheat during the winter seasons and then rice during the monsoon seasons. And then in the kind of subsequent months of those seasons, there's this burning of crop residue. And we're seeing that a huge amount of PM2.5 is released, especially after the burning of the rice residue crop. This is due both to the kind of residue that's being burned, but also there's greater meteorological stagnation later in the year that is really driving this poor air quality. And we have a lot of nice tools to look at these kinds of dynamics, looking at Landsat satellites going down into the meter resolution scale to actually look at individual fires in India. But really, given how much of the burden of air pollution and poor air quality that is experienced in India, there's not nearly enough data to characterize these large-scale kinds of problems. Now we go to Southeast Asia. A lot of this smoke and fires are due to the burning of peatlands. So if you don't know what a peatland is, it's basically like a bog or a swamp. It's basically kind of a large organic carbon landmass that's typically pretty wet, right? But we see that drought events linked to El Nino climate phenomena has really dried out these bogs, basically. And so they're becoming drier and drier, and which we know when there's increased incidences of drought, we can have these sparks happening in these peatlands, which then leads to these very low-intensity smoldering fires that just kind of emit soot and smoke throughout Southeast Asia. You can really clearly see it from satellites. And so we know that it emits a lot of smoke, but also is a huge carbon source as well. This is work on the right by Miriam Marlier, who's at UCLA, finding that peatland intervention scenarios, which really is trying to redirect canals to basically re-wet the bogs, right? To put more water back onto the peatlands, has the potential effect of reducing smoke exposures and fatalities, mortalities by nearly 70%. And so going back to the United States, we're really seeing these record-breaking wildfire seasons in the West. This has been the last decade, especially in 2018, 2020, and 2021 that we're seeing. This is both due to elements of a warming climate, but also this 100-year legacy of fire suppression of which I talked about. And really, there's this now large interest of maybe we can look towards prescribed burning, right? So the idea being that prescribed or controlled burning has been this long-practiced indigenous cultural burning strategy of using fire to treat the land and to use fire to actually burn off this low-level brush. And maybe this is a way to prevent future wildfires, because we didn't see wildfires of this magnitude before Europeans came into North America. The problem is that prescribed burning in America is a complete socio-ecological and political nightmare. So what I'm showing you here is the total burned area by different fire types in the United States. And that we see in the eastern United States, controlled burning is actually very common. It's a very routine land management strategy, especially in the southeast, whether this is burning off sugarcane crops or treating ecosystems for both ecosystem health, or people just want to go hunting, for example. It's a really common practice. But it's very much a boutique application in the western United States, where the dominant form of burned area are from these out-of-control wildfires. And you might say, why not just ramp up prescribed burning in the western United States? But we really don't know what the implications are. What you might be doing is trading off smoke that's experienced by large populations in cities for weeks out of the year to those kind of shifting the burden onto rural frontline communities that then experience smoke for months on end. And to kind of look at this, this is a paper I put out last year with a co-author from the United States Forest Service, looking at recent prescribed burns in the West. The pixelated, colorful base map here are outputs from air quality models that many of you have run or will hear about through the next couple days, looking at September 2020, which is the high of this really bad wildfire season, looking at smoke PM 2.5. The black dots are satellite-derived locations of large prescribed burns, large being greater than 1,000 acres. And this is for a 5-year preceding period before this month. And you notice there's a mismatch between where these aggressive prescribed burn treatments have been and where smoke has been the largest. But it really depends state by state. In Arizona, we have aggressive land management kind of treatments in the national forests of the Tonto and Apache Sitgreaves forests. Looking at Central Oregon, this is largely agricultural burning on privately owned lands, whereas we know wildfires typically occur more often on federal lands. And looking at Western Oregon and Northern California, there's only 7 prescribed fires of this magnitude over this period, even though you would argue that this is where we need it the most. And so people who might be familiar with forest management and hear that number, 7 prescribed burns, that doesn't sound right. That's basically nothing. And you'd be right. In fact, there's not just 7 prescribed burns in California over that 5-year period. There's almost 10,000 of them, but they're just very small in size. This is a data set provided to me by the United States Forest Service of on-the-ground land managers doing these kinds of treatments. And when we filter by the size of treatments, even exceeding 500 acres, which is just 2 square kilometers, less than 1% of all treatments are of this magnitude. And there might be an argument for applying a small number of large burns rather than many small ones, because many small ones might not be enough to undo the legacy of 100 years of suppression in America, and it will just generate a lot of smoke in these frontline communities. And the last note I want to leave here is that right now in Northern California, we're burning less than 11% of what we did before Europeans basically came on the scene. So my 8 minutes are up, and I'll leave my conclusions up here. Thanks so much for your attention.
Great, thank you. All right, our next speaker is Dr. Kenza Khomsi, and she is head of the Climate and Climate Change Department at the General Directorate of Meteorology in Morocco. Dr. Khomsi.
Hello, good afternoon, everybody. First of all, I want to thank HEI for organizing the conference, and thank you so much for having me. And in fact, it's my first time in Philadelphia. I'm here today, and I will talk about my enemies. I don't know to what extent it is wise to talk about enemies in international conference, but I will do, and I will even reveal my intentions. But let me first share with you the story. So my story with my enemies started when I was young, and my mom was convinced that the easiest task a child can do is to clean the dust from the surface of the tables. I was this child in charge of this. I was hating this. And all the time I was thinking, when will I grow up so that I can be the superwoman who will fight dust? I grew up, and then I discovered that my enemy is invisible. But once it becomes visible, it can make you human invisible. This is frightening. Then I discovered that my enemies are everywhere, at home, on the table, at work, outside, at the ground, at the atmosphere, really everywhere. It's really weird how these tiny particles that are light enough to be carried out by the wind, and they can contain lots of small other particles, ash, bacteria, pollen, smoke, salt from the ocean, dirt, pieces of rock, and even sometimes pieces from the human and animals' hair and skin. So then I said, okay, I need to change the strategy. This will never work. So I said, okay, let me understand how this dust is created. This is what I found. We need, in fact, 2 conditions. First, the appropriate emission conditions to allow the dust production, which is the soil. And then the appropriate dispersion conditions, which is the meteorological conditions to supply momentum to the surface, which is wind. Okay, so I said, great. Now, I need to see these locations on Earth. Maybe I can be the superwoman who will remove them from the Earth. And this is what I found. So these are the main places that are supplying the dust to the Earth. So we have number one, which is the Sahara of North Africa. This is basically the source of my troubles. And number 2 is Arabian. Number 3 is Asia. 4 and 5 is North America and South America. Then 6, South Africa. Then 7 is Australia. And then to the right, you can see the loads of the atmosphere. The intense part is the dust from the North African Sahara. So these places are regularly emitting dust to the atmosphere and to the ocean. But this is not enough. We need what will create the flow. We need what will create the movements, and this is happening because we have what we call the general circulation. Around the Earth, we have the atmosphere. The atmosphere is a set of cells. We have the polar cell, the mid-latitude cell, the Hadley cell, the Ferrel cell, and the cells are a set of ascendant air, descendant air, and this is creating what we call the wind, and the wind is causing the dust to move around the Earth. But dear dust, while you are dancing around the Earth and traveling, we are suffering, because the dust, while traveling, they can change the world. They have lots of impacts. They can absorb, in fact, the radiations that are coming from the sun, the radiations that are coming from the Earth, and impact the climate. They contribute to what we call the parasol effect, which cools the atmosphere, and the greenhouse effect, which warms the atmosphere. Then the dust, if they are part of a cloud, they can alter the properties. They can act as nuclei and create rain. Then they can go through a wet deposition and regain the land, or they can go through dry deposition. Then they can join either the ocean or the land or a snow and ice cover or layer. So if they join the land or the ocean, they can impact the biogeochemical cycle and transport nutrients and deposit them. If they join a snow or an ice layer, they can impact this to melt and impact the Earth's albedo. And you know, dust stories are more dangerous when the dust decides to ally with other friends and then create what we call dust storms or sandstorms. And in fact, if a ground of soil is undergoing intensive heating, this will create a layer of warm air to form like near to the ground, and then create an ascendance of the warm air and then descendance of the cold air, and this will create convections movements and will create turbulence, and then we will have the wind and then make this to move to attack a city, and this what creates sand and dust storms. And in fact, these have lots of impacts, mainly on human health. Here, to the left, you can see the schematic diagram of the respiratory system with aerodynamic sized particles deposited within each system. And in fact, the smallest the particle is, the strongest it is to reach the pulmonary system. And this creates lots of diseases. So PM10, that you can see at the right, PM10, which is particulate matters with diameter less than 10 micrometer, can cause lung diseases. PM2.5 can cause skin and eyes diseases. PM1 can cause tumor diseases, and PM0.1 can cause heart and lung diseases. And this not only near to the places where we have dust, but even far away if these places are attacked with dust, which is brought by wind. Here, you can see collection of the different diseases that's caused by dust and desert storms, and you can have more information. This is one of the recent studies that were done by the WHO, and in fact, they collected 204 studies from around the world that are assessing the impact of desert dust and sandstorms on health. And in fact, it was clearly shown that there is a relationship between desert dust and sandstorms and health outcomes, including hospital admissions, symptoms and dysfunction, mortality, and so on. And also, the link was clear with adverse health effects, mainly when we are talking about respiratory and cardiovascular diseases. If we want to add some quantities to it, I'm referring you to the last report from the World Bank about sand and dust storms in a place which is very known with this climate hazards, which is the MENA region. And in fact, and I will be reading here, in fact, the report shows that in Kuwait, dust storms led to 8.4% increase in daily emergency asthma admissions over a period of 5 years, mainly between children. And in Qatar, asthma cases are reported to increase by 30% during and shortly after very windy conditions. The 2005 dust storm in Baghdad, Iraq, led to nearly 1,000 cases of suffocation. And populations in Iraq, Egypt, and Pakistan suffer in terms of premature deaths because of bad air quality. So this is the case, this is the idea. I cannot fight that as a superwoman, and we cannot, but what maybe I will say is what was said by the Pakistani author, Muhammad Iqbal, who said, it is true we are made of dust, and the world is also made of dust, but the dust has modes rising, so by the end, dust is us. We have nothing to do apart from adapting to it and mitigation its effects, and thank you so much.
Wonderful. Thank you so much for that. Up next, we're going to hear some short remarks from one of our first panelists. So we're about to hear from Dr. Ndyabakira, and I apologized in advance if I didn't do a good job with that, but he is the head of the air quality management from Kampala Capital City Authority in Uganda. Shortly after his presentation, we'll welcome up the other panelists to have a full discussion.
Thank you so much. Allow me to bring to your attention that sometimes politics starts where science or economics ends. But sometimes what makes a lot of scientific sense fails to make political sense, and this is so common in the developed world. It affects uptake of scientific evidence. I would love to draw your attention to the fact that when we are addressing or mitigating effects of climate change, for instance, air pollution, we need to balance the resultant negative effects of your mitigation measures with the effects on livelihoods. If that balance is not well maintained, then you get the communities rise against you. And these communities, oftentimes, when we are implementing these interventions, may actually be very powerful, either politicians, because the effects of whatever you want to do to reverse what you think is a very bad trend is actually infringing on their voters, and so they feel the voters are not protected, and they may hate them, and since it's voters who give them jobs, then they may lose their jobs. So you always have to find a very wonderful balance. So sometimes what is very scientifically accurate fails to be implemented because the mitigation measures will cause more chaotic scenes. The second one is providing alternatives. We have had to implement very wonderful measures aimed, for instance, at improving air quality. And an example, one of them was when we were working on anti-smoking in public. We passed a bill and we had to enforce it. Little did we know that we had very powerful forces behind this that wanted smoking to continue, that mobilized farmers, tobacco farmers, brought them on the streets. And so you have to provide an alternative. We are moving this cash crop. What should the farmers do? What should they be earning? But in actual sense, the farmers are being mobilized by possibly someone who owns a cigarette factory. So if you do not provide alternatives to some of, to mitigate the negative effects on livelihoods, then your intervention will be, the silent stakeholders may have a very powerful stakeholder with a wonderful voice who may actually technically defeat you even in courts of law. The other one is to think about multiple community benefits, and this is so true where resources are very scarce. An intervention with just one benefit, even if it's very wonderfully shown to produce that effect scientifically, will likely not be favored by the policymakers because they are looking at using $1 to achieve 4 things, 4 results, as opposed to delivering one cutting-edge result versus 4. So you look at interventions that have several benefits compared to one wonderful benefit. In so doing that, like my colleague has said earlier, we look at health interventions, for instance, messaging, to raise the risk profile about protective measures that can protect people against the negative effects of climate change, or things like air pollution, amplifying the need for the actions to take, for the populations to take action, but also importantly, linking how public health is related to climate change effects. Oftentimes, when we have infectious disease outbreaks or conditions related to health events related to climate change events, for instance, when you have flooding and you know you will have resultant waterborne diseases, you have air pollution, which is known to be a universal risk factor for a number of NCDs, but also drought conditions that can be an issue, for instance, to food security. If you rate this to how it affects public health, then the message will be taken up, as opposed to talking about climate change, air pollution, very difficult to see with the naked eye, and you fail to draw the link. Lately, we've had many emerging and re-emerging infections that can be linked to climate change, so that you drive your point home. The second one, and quite very important, is being able to quantify the change, the climate change events. You measure them scientifically and attach a value. This makes communication very easy to populations, but also to their leaders. Air quality cannot be seen. Sometimes very clean, clear air is actually heavily polluted. But if you're able to measure and attach a value, attach a color code to speak to your illiterates, to speak to the people who not quickly understand graphs, but they can understand color codes, it makes it very easy to communicate quickly and spur action. You must cost most of the interventions. If you have scientific evidence that does not relate to the costs, either gains because you're saving lives, or losses because you're losing lives and money, it's very difficult to have policymakers and politicians on your side. Oftentimes, when we are speaking to them, they ask you about financial implication. Your Ministry of Finance, or whoever is in charge of finance in that country, wants to understand, if I take this action, how much money am I saving? How much money am I making? So framing interventions aimed at improving, at mitigating climate change effects in terms of investment as opposed to expenses, you carry a point home much better and with ease. So everyone looks at, for instance, that health expenditure as an investment in terms of looking at it as an expenditure. Lastly, the costs associated with pollution, for instance, or other climate change effects, if well costed, and you show that this is the amount of time kids will lose attending school, like happened in India recently when they had too much pollution and they had to close schools. This is what the country loses by people not working. It becomes very easy to fill that gap that my colleague from the UK National Institute of Health Statistics talked about, the policy gap. You're able to move the scientifically available evidence into something that we can easily implement, especially in a city setting. Thank you so much.
At this point, I'd invite the speakers, panelists to come back up. So Alex, come stay up here.
Yeah, we should have told you. Greg very kindly reminded me to apologize. Unfortunately, Michelle Bell was supposed to be on our panel, but she has come ill and was unable to make it. So I present to you Greg, who is now Michelle Bell, also an expert in climate change, so we will be in very good hands. Thank you to everyone. We really enjoyed your talks. I have a set of pre-prepared questions to lead our panelists through. And then afterwards, we'll have a short time to open the conversation to the whole room. And then I have a few wrap-up comments ahead. So first off, I wanted to start with a question that is targeted towards Dr. Ingole. We'll start with you. You talked a little bit about the sharing of information and data needed to do this work at the end of your talk. I wonder whether or not you can think or discuss for us, what are really the gaps that we have in data in order to move this field ahead?
Thank you for this question. And this is not something which is not well-known challenge or the biggest gap that we all already know. The biggest gaps in particularly air quality and public health is the incompleteness of the health outcome. There are different challenges with respect to the big data gaps, depending on which countries or depending on which health outcome and which areas we are talking about. I will give you an example, the one which I faced during my research and currently the one work which we are doing with University of Ghana in Ghana and also in AIMS in Rwanda, and some of the biggest gaps with respect to the health outcome. The exercise which I show on the SSPs and RCPs, we assume in that example that the same exposure response function which has been used in global burden of disease and other estimates, assuming the same exposure response function at the local scale, which might underestimate some of the findings because the local phenomena slightly different than the national averages, because there was no cause-specific deaths on the NCD and LRI was available. So we have to assume the same NCD LRI estimates which was used in global burden of disease, and these were like mostly the national scale rather than local or local scale. The second example where we currently working with those two settings, and most of the work previously and currently is focusing in India and Africa, so I will talk mainly from that perspective rather than the high income or any other developed setting. So there also we face the similar issues for doing some of the health impact assessment studies using the similar approach of the comparative risk assessments, and we do not have the enough complete data for the cost-specific deaths. So that is very well-known challenge. There has been significant amount of improvement with respect to air quality measurements, particularly recently with the low-cost sensors and so on, but not with the same space for the health outcome data sets in those settings. Thank you.
Yeah, wonderful, thank you. That is an important point. The next question goes to Dr. Kelp. Where do you see some of the biggest gaps in our scientific evidence?
Yeah, I think there are more gaps than not with this field. So, we see emerging evidence that we know the role that climate and vegetation plays in creating fires, but we don't necessarily know the feedback effects of fires then influencing that of climate and vegetation. But a bigger kind of question is mitigation of wildfires in America or North America even possible? Fires are really cognitively complex in many ways, right? When we think about air pollution or climate change, it's usually the largest mitigation strategy is to turn off emissions. You can't really turn off a fire, right? We don't know when, where, how fires move, spread, start. It's very difficult. Who would have predicted all of Canada being on fire this last summer? So it's really almost a random process. It's also very tightly coupled to forest management and kind of the history of the United States as well. In terms of other gaps, satellites can tell if where smoke is kind of moving around in the North American continent, but we don't know if that smoke is on the ground where people breathe it or if it's aloft where people don't breathe it, but health effects studies are now attributing kind of in an ill-advised way that smoke aloft from these satellites are experienced by people on the ground. So our tools are not complete there. We know drought and vapor pressure deficit are really good predictors of potential fires, but we don't know how to stop a fire once it's actually burning. And there's this idea that maybe ramping up prescribed burns, which I believe is going to be one of the most pressing issues on the table in terms of policy for the remainder of this decade. We don't know if doing that in the Western US is feasible. What you might be doing is generating a lot of smoke in rural, kind of frontline vulnerable communities. We're releasing carbon, right? We're still burning fuel. And in many ways, prescribed burning is kind of the least advanced way of tackling potential fuel buildup because you're just burning that into smoke. The problem is there's a lot of socio-ecological problems in the United States. So the discussion about prescribed burning is not nuanced at all. You have two camps that are really against it and really for it. Those who are against it are usually, insurance companies. They are rapidly pulling out of California because any kind of escaped burn, which is actually non-trivial, happens all the time, has a huge potential consequence for damages on people and people living near kind of the wildland-urban interface. We also have a lot of kind of nature conservationist societies and environmental lobbyism kind of against this as well. The idea of conservation in America is to protect kind of natural resources and forests from fire, whereas now you're kind of saying we should integrate fire into this kind of framework. So it's, again, this dissonant idea of what American conservationalism is. And, a lot of people who are for prescribed burning are scientists and regulators, right? But the end goal, like everything that's nuanced, is probably somewhere in between. Maybe do prescribed burns in very specific scenarios in very targeted ways, which right now we don't have a very good infrastructure or framework to do this. But I think hopefully there will be more kinds of research on this topic soon.
Thank you. It is a very hard problem. All right, so now we have a question for Dr. Dr. Khomsi and Dr. Ndyabakira. So for both of you, what do policymakers really need? And what are the key issues that they are concerned about with respect to air pollution and climate change?
Yeah, thank you so much for the question. And I would say, and I think that my friend from Uganda is presenting policymakers, and I liked when he talked and he mentioned costs and money. So I think the mysterious word for policymakers is money and time, and already time is money, so it's money. So I would say two main important things for policymakers that I deeply believe in: cost effectiveness and enhanced preparedness. I think it's great to prepare evidences, it's great to collect data, do research, and whatever we want, But policymakers need really strategies, actionable strategies that are really cost effective. And if I want to share a little bit about the policy cycle, it starts from problem identification, setting agenda, policy formulation, policy implementation, policy assessment, and then problems identification. And the question, where are scientists now? Definitely at the problem identification. We are very related to problems, and we are creating troubles to policymakers. We are not in the other places. We need to be in the other places, thinking about cost effectiveness and presenting kind of information and insights about how policymakers can prioritize, because by the end they have a lot to do, and they need to know where they start. This is the first thing. Then talking about enhancing the preparedness, and here I'm always thinking about the crisis. By the way, there are no superheroes. I tried to be one, and I was not able to do it, but all of us at one time can be the superheroes that appear within the crisis times. And this readiness and preparedness, this is what the policymakers need. For me, it is really, I would say, old-fashioned to have, for example, an atmospheric scientist working on an early warning system about heat wave, and then an air quality scientist working about early warning system for air pollution in a place, and then an epidemiologist in another place. This is not what the policymakers need. Policymakers need integrated approaches. They need everybody to work together and give kind of realistic and concrete information. And this is happening when we have what we call the policy window. And the policy window is happening when we have this cross-cutting between the problem stream, the policy stream, and the political stream. So I think that two main things that scientists need to focus on: cost effectiveness and preparedness. Thank you.
I almost wanted to say that I have nothing useful, more useful to add, but I will add something, especially starting from the issue of the policy window. I also allow me to appreciate the approach that HEI uses. Let's not bring the policymakers on table at the end. You may cook what they are not interested in eating. If you start the way HEI, for instance, does it, at least in my interactions with them, you do that 360-degree planning together. You are answering the questions that they have. You bring on table the data that they exactly need. You will study, bring evidence that they are interested in getting from you. So that way you have a common understanding. From problem identification, you agree that this is actually the problem. When a policymaker is with you on table, trust me, you'll be looking so much at science and your p-values and confidence intervals. He's going to be looking at, does this actually work? Does it benefit my people? When I intervene in X, do I lose balance? Does Y disappear? Or is Y is still in the equation? We look at, at the whole, for instance, the whole government in totality. You may be thinking air quality 311, but there is also transportation, there is also health, there is education, I'm not going to get all the money and I put it in air quality and make air quality very wonderful for children who will not go to school or will go to hospital and they cannot find doctors. So it's always a balance for the policymaker. This policy is very wonderful, but where do I get the money to implement it while not losing the gains I have made in all other sectors? And that's why you have to have a common understanding of the problem so that the findings can actually be taken up. And I will retaliate what I had already said. For instance, in Kampala, we use what the motorcycle taxis. Just carries one person, has a two-stroke engine, mixes oil and petrol, burns, combustion is incomplete. So much pollution. But this is heaven for the youth to get employment. These would have been thugs on the street hitting people with hammers. They are not doing that. We all know these motorcycles are worsening air quality, which causes disease. But if you say, I don't want you in the city, I want you out, which is easier to say and actually implement, because you can just get them out. We're in charge of the city. We can get them out, we can deny them license, and we end it. your population will still lose lives to thugs, because all these are going to be thugs the next day. So in tackling that, I must come with an alternative. So if a scientist shows me that actually these are causing air pollution and removing them will take away this amount of air pollution, wow, that's cutting edge. It's obvious, those effect relationship. But I will still lose the people from another cause as a result of implementing that. So let's have them on table, have a common understanding of the problem, so that then we are able to have a common understanding of the findings and how they can be implemented.
Thank you. It's so wonderful to have the global perspective represented. I really appreciate both of your voices here. The next question is to you, Dr. Wellenius, about really the US perspective and thinking about the type of scientific gaps that are here and what we need for our local policy makers, what they're interested in, and what their priorities are.
Yeah, thank you. I mean, Kenza, Alex, I really appreciate those very insightful answers. And I think what you're really highlighting is that policymakers need the information to make some really hard choices. So there's no such thing as a solution that doesn't involve a cost or doesn't involve a trade-off. And as scientists, I think what we can do is provide a lot of that information, or at least strive to provide that information in a way that is actionable at the local and national levels. And to some degree, that means, and I think this is true everywhere, it's understanding the risks associated with different hazards or with inaction, providing information on effective solutions, and that's unlikely to be the same everywhere. So the risks we face and the vulnerabilities we face are context specific. So prescribed burning may work in some settings and not in others, or may work better in some settings than in others. And then I think really importantly, we need timely data to be able to measure whether we're making progress, whether we're moving in the right direction. And historically in the US, a lot of those data are not readily available. So how do we track our progress? Even with something like deaths due to extreme heat, it's hard to know how we're doing if we have to wait a couple of years or more in order to get the health data to be able to put a firm number on how many people actually died, how many excess deaths were there with, say, the 2021 heat dome that affected the Pacific Northwest and Canada, Western Canada. So having timely data so that we can measure our progress towards these, and then this becomes an iterative process of assessing the risk anew, assessing what might be the most effective solutions in a localized, context-dependent way, and then working with implementation science, researchers, and methods to actually deploy those solutions in the most effective way, and then timely data to be able to iterate over and over.
Thank you. All right, the last question that we have for all of you is actually really pitched to anyone who wants to answer. And it is thinking about these mitigation strategies, early warning systems, and things like that. Just thinking about, is there research that you're doing on this, or is there information that's needed to inform strategies so that we have a better understanding of how those systems are working? It's not an easy question.
Yeah, I can have an answer to this, and I want to, by the same time, also talk about one of the work that was done by the Climate and Clean Air Coalition in Africa, and I think that Africans should be proud of this work. And it was about the integrated assessment of climate and air pollution in Africa, and Kennedy was part of it as well. And the idea was definitely to create kind of strategies that are actionable based on cost effectiveness perspective. And the work was done marvelously, and we have the report, and everybody was involved, scientists, policymakers, communities, and everything. And then at the end, the question was, how can we implement this? So we did all this work, but then the implementation was a problem. And I think, and now the Climate and Clean Air Coalition is working on the implementation plans, and this is what we are working on. And I think it will be kind of, I will not say that it will be 100% successful, but it will help countries to have insights about these actionable strategies and kind of taking African people steps forward.
Fantastic.
Yeah, maybe I'll just add quickly to that we're finding out that just warning people about risks is not usually enough to change health outcomes. That if you want an effective early warning system, it has to be coupled with concrete actions that individuals can take and that governments can take or emergency response agencies can take in order to help those people that can't help themselves. So I think even, again, with something as straightforward or seemingly straightforward as days of extreme heat, it's really hard to know what would work to do that. So telling people it's hot out, most people I think know. Telling people that this is a risk to their health, the surveys show that most people don't believe that it's a risk to their health. They think it's a risk to somebody else's health. There's other old people, other people with medical conditions, not me. And then once you even understand the risk, it's, what do you do about it if you're not in a position to be able to work from home in an air-conditioned office or air-conditioned home and pay for that electricity? So there's lots of people that don't have easy choices. So it may be that, yes, I'm an outdoor worker and that on this day of extreme heat, I understand there's a risk, but there's also a risk that I won't get paid if I don't finish this job today. So these are, again, goes back to my theme of these are really hard choices, and how do you provide individuals, communities, governments, and other stakeholders with the information they need to really balance out and make these hard choices in an evidence-based way rather than in a more ad hoc way.
I think what I can add is that just like governments can have many competing priorities, and that's very true globally. Even at an individual level, people seem to have their lists of priorities. So what for us scientists and implementers sometimes think is what is very priority is oftentimes not what is priority to the people. So we would have to have mechanisms of raising the risk perception of what you're calling climate change, what you're calling air quality, and the resulting public health effects, negative effects, so that your community and populations actually see air pollution, see climate, negative climate effects as with the same lens that the implementer, the policymaker, the scientist is actually looking at them. That we're running them to take action will be very easy. We do this quite a lot when we have outbreaks. You know that Africa is often faced with many disease outbreaks, including the very deadly ones like Ebola. But if I did not have food for my family the previous night, what are you doing telling me about COVID and COVID lockdown? After all, I'm going to die of hunger, so let COVID actually kill me. So I have to make sure that you are looking at COVID as a threat as much as I am thinking that it's a threat, me as government who now claims I care for you more than actually you care for you. So we need to have mechanisms of raising risk profile for someone in the community to look at air pollution as a very serious threat and high on their priority list of problems.
Anybody else? Okay. Anyone? No? Okay. What? No. Oh, yes. Yeah, that was exactly where we're at. Thank you. Very interesting conversation. We now do have some time for audience questions, if anyone would like. We've got microphones up front, and I see we have one person already. If you could please just introduce yourself and where you're from before your question, we'd appreciate that.
Yeah. Hi, I'm Anarelli Morales. I'm Air Quality Policy Analyst for Weld County in northeastern Colorado. So I work in the Public Health Department. So I really, really appreciate Dr. Ndyabakira. Your thoughts were exactly what I've been dealing with. And so I have two questions, if I'm allowed. But the first one would be, so we have in our state a lot of, I guess, maybe two groups. One that is more like focused and passionate on making solutions, and we need to reduce greenhouse gases and improve air pollution right now at any cost because lives matter. And then the other group of folks that are more, it's not that they don't care about the health of people, it's more that they have to consider the cost, the timing, the capacity, and all these things. And so how how do we get these people to talk or at least listen to each other? Because I'm seeing maybe more environmental groups seeing, I don't know, like government people that I would work for, as you don't care, all you care about is money, all you care about is industry, versus maybe those people see the other ones as you're an activist, and all you care about is your agenda. So it's really polarizing, and it's hard to sit in the middle as a scientist and an advisor. So I guess, what are your thoughts on that?
Thank you for that question. That's very common.
Yeah.
I think globally, you will always have your allies, and you have those who are actually sometimes against you. For air pollution in particular, unfortunately, those who are most times against us are the most powerful ones, either financially or somehow they are making gains by not taking the actions that you want them to take to improve the air quality. I am not sure you are able to apply the polluter pays principle, which is very common in most places. If you generate pollution, either as a country, but also as an individual, you should be able to pay for it. But sometimes, because they are very powerful, it's even hard to apply that on them, because they are able to reach with ease where you cannot easily reach. I think the most important strategy that would work for those is approaching them on case-by-case basis. When you have many enemies, in quotes, do not bring them in one room. They will be very powerful. You interact with each enemy at a go using different approaches, and then you ensure they are the lead, and you request them to speak for you. That's what we've done. We've had this especially from the opposition of government, who view every intervention you bring with an opposing face, because they feel what is government now bringing against us. When you speak with them one-on-one, make them understand, and as soon as you understand me, you are part of me, and I make sure you start speaking for me, it makes it a bit easy.
That's fantastic. Can I get one more? Or go ahead.
Yeah, why don't we do Mike, and then we'll come back to you.
Hi, Mike Kleeman, UC Davis, and I really want to say that I appreciate the global nature of this conversation, different perspectives. From a global perspective, I live and work in an ivory tower in California, and so maybe I'll qualify that before I make my comment and then ask for feedback from the committee. What I've seen is that as we clean up the air pollution system for the human-made sources, the cars and the trucks and the factories, the climate penalty actually gets smaller. We see the climate penalty shrinking for both ozone and for airborne particles as you just meet the air quality standards as a starting point. So if we would focus on meeting the air quality standards all over the world, I think that the penalty that climate change might have might be quite a bit smaller. Now, that's not wildfires and that's not dust storms. Those are more natural phenomena. But for human-made sources, I think that that is a true statement. At least we can see it in California, and I think you would see it other places as well. As you meet the air quality standards, you do the things that you have to do to meet the air quality standards, then the climate penalty won't be as big. So that didn't come out in the conversation, and I'd like to get feedback from the committee on your thoughts on that.
Yeah, I think that's a great point, and I think it has to be both and. So obviously we have to control those sources and factors that we can on the emission side, and plan for those sources and emissions that we can't control, like or that we can only control in the longer term by learning new strategies for wildfire smoke mitigation. So yeah, I think let me pause there. It's just I agree that you have to tackle both and. It's not one or the other, and I don't think although we focused on these episodic events, I don't think we meant to exclude the importance of ongoing achievements of air quality gains from sources that we can control.
Yeah, I think that's a great thing to acknowledge. We're seeing, like what Greg said, with these controls on air pollution, largely in sectors of power plants, on-road vehicles, and in urban areas, we're really cleaning up pollution. But a lot of this is starting to become undone by wildfires and other natural occurrences that are amplified by, this climate penalty we're seeing. There's this idea that maybe if you clean up PM and aerosols, that will actually could potentially exacerbate climate in some areas too because of this scattering of aerosols. So, that has to be acknowledged. There's huge uncertainty bars in all of these kinds of sources. We're also seeing that in the Western United States, in basins like in the LA Basin, Central Valley, Salt Lake City, these areas that pollution controls are, working, but pollution is staying stagnant, if not even getting worse, because of very complicated kind of dynamics that are also in play. So they're all kind of coupled to the climate weather emission systems. And in a way, we're, even just a couple months ago, we passed the new annual average standard for PM 2.5 going down to 9 micrograms. So there is this kind of momentum of air quality regulation in the United States, but, they're both being undone by these natural sources, and some of it is actually pretty complex and nonlinear. But definitely, we don't want to create this kind of thunderdome of echo chamber here.
Okay, thank you.
Hello, I'm Rachit Sharma. I'm a grad student at Drexel University. I have a question specifically for Dr. Ingole. In your presentation, I think in one of the case studies, I believe it was Mozambique, you reported that the two scenarios, SSP1, which is the green sustainable pathway, and SSP5, which is the fossil fuel pathway, the PM 2.5 attributable deaths were the lowest and so much so comparable, if I'm correct. What's your take on that? How were they modeled to have the same PM attributable deaths? Because these are two extremes. And the follow-up to that is, how have you communicated these findings to the administration in Mozambique? Because these are two different paths, and fossil fuels are definitely cheaper.
Yeah, so thank you for this question. And obviously, with this 8 minutes presentation, I was not able to present in details all the SSPs and what are the underlying. So the SSP1, which is highly favorable in terms of adaptation and mitigation, and which was supporting the less number of attributable deaths with respect to PM 2.5. And the SSP5, which is also a more fossil fuel development, but at global scale, the fossil fuel development in terms of for the those countries who are underdeveloped. So giving those countries opportunity to have that fossil fuel development, fast economy, high education, high inequalities, and so on. So take into consideration all the narratives, qualitative as well as quantitative, with respect to population, GDP, education, migration, fertility. So take into consideration these two scenarios where we found these were the scenarios where we have a less number of deaths, assuming that even in sensitivity analysis, we show that there is no demographic change, there is no demographic, still there is a low burden of the diseases among these two ones. However, opposite to that, SSP3 and 4, where we have a high challenges with mitigation and adaptation, we see the high burden of diseases. And this is something the earlier points also covered by many of us, that having this global international cooperation really affect at local scale.
And how has the messaging been around these two scenarios? As a researcher, what are you saying? So fossil fuel pathway or the green pathway? What is your take?
So SSP, yeah, we want to go SSP1 and SSP5 at the same time, so that we can see the development.
All right. Thank you.
Great, thank you. Maybe we'll do Brian and then back over to that mic.
Hi, Brian Hubble, EPA. So one of the things I've been hearing that I think is important for us to keep in mind too is that when we think about climate change impacts, it's not just direct climate change impacts, but our responses to climate change that also have an impact on air quality. So that's mitigation, but it's also adaptation. And Dr. Kelp was talking about this in terms of if we move to more prescribed fires, we have to think about what are the air quality implications. But it's not just fires. It's also, for example, when we're trying to tighten buildings to make them so that they're able to be air conditioned better, well, that has impacts on indoor air quality. There's also concerns related to when we think about sort of how we're not just directly reducing emissions, but when we're putting in place technologies like EVs, when we have more critical mineral mining, that can have impacts in terms of air quality as well. So I wanted to get your thoughts on how we can make our research framing more systems oriented so we can think about the full range of impacts and not just things that are occurring now, but also as we think about the evolution of our energy and our adaptation systems and how they affect air quality. So if you could speak to that, I would appreciate it.
You stumped them.
I only know about fire, so it's going to be a little narrow here. But, you know, in terms of considering, you know, maybe you can consider a life cycle of decision making, right? When planning a prescribed burn, potential future averted smoke is not considered at all. It's just the smoke of the fire itself. Can we contain it and make sure it doesn't, you know, get out of control? But, you know, there's no kind of targeted assessment of this would be the area that has the highest risk of burning and then also being transported to downwind communities. There's nothing like that. And, you know, we have to balance the ideas of mitigation versus adaptation. If you want to ramp up burning across the entire western United States, are we going to just create more problems and still have future wildfires? And maybe adaptation is the strategy. Right now in the western US, the largest adaptation strategy we have for fires is insurance, which is kind of depressing to think about in that way. But, you know, we see that when we kind of model these health effects and mortalities, you would assume kind of a linear response function of deaths. But we're actually seeing that after 200, 250 micrograms, that hospital admissions actually starting going down because there's a behavioral response from people, right? We stay indoors more. We will wear a mask when you're outside, just delay your run by a couple days. So there are these adaptation strategies. But right now, it's kind of what is the cost benefits of doing this? And we have to have this really long-term thinking, which I think the other kind of policymakers on this panel will be able to talk about better than I.
Right.
Yeah, one of the things I've learned, and I think scientists need to think about it, it is about the mindset of a scientist. So we need to stop to have kind of this mindset of a scientist and this, instead of thinking about science, thinking about everything. And one of the things that I've learned to take into consideration whenever we want to create kind of a research project is about thinking about the external pressure and the internal pressure. And now, I think in every country, it is well served in terms of strategies and international engagement. So you can see the indices, the biannual, for example, climate reports that are talking about the different strategies that a country will adopt for itself. So as a scientist, if you want to have this holistic view and kind of be or having this vision, this long-term vision, it is about taking into consideration this strategies mainly when this is related to the international framework and the international vision. Then once you create your research project, you need to see who needs to be involved. And one of the things which is very important is to involve communities. It is about seeing what is really serving people. And one of the things which is very interesting now is to think about involving psychologists and social scientists in every work which is related to climate. This is what really ensures the resilience and sustainability of our work. Over.
Great. All right. You finally have your chance.
Thank you. So earlier there was a discussion on raising the perception of risk for air pollution. And so this was, do any of you have policies where it's similar to like severe weather, where, there's air pollution event, we're canceling these outdoor events, or there's an air quality or air pollution shelter? Like, what is your perspective on that? Like, to truly elevate it to the seriousness that it is, should we start implementing policies that treat it kind of like a severe weather event?
I mean, the challenge, so I'm not a policymaker, but the challenge is that we don't have a lot of evidence of what works. And so you mentioned the air pollution shelter. Again, going back to the example of heat, where we offer cooling centers that anecdotally, there's not a lot of good evidence, but anecdotally, many local health departments say that they open cooling centers and that nobody goes. And so how many people would you have to get to a cooling center on a super hot day to prevent one death? You can do a back of the envelope calculation on that. And with air pollution, it's even harder, because how long do you have to stay in a air pollution shelter or refuge? Where do you put those? So, you know, is it in urban areas? Is it in more rural areas? So these are all really good ideas, and we should be pursuing them. But we need to provide local decision makers with the evidence that they need to be able to make those smart choices.
Awesome, thank you.
Great. And actually, if you don't mind, really fast, I'd like to just interject one other question that came in. It's a little bit of a follow-up, right? If we think about these extreme weather events and trying to form protection, one of the things that I've seen is that, oh, it's just natural. You know, yeah, it's forest fire, it's dust. I wonder if Dr. Khomsi, you might be able to sort of speak to the idea of sand and dust storms as natural, and whether and what the role is in climate sort of in exacerbating these.
What role?
What role climate has in exacerbating these dust storms and sort of this natural, I put in air quotes event.
Yeah, I think that now science is lacking evidence to just create this information about this is natural and this is not natural. But definitely, again, this sandstorms and dust storms is an example where we need this integrated approach of having everybody working together, atmospheric scientists, climate scientists, air quality or air pollution scientists, to come up with this integrated approach of an early warning system. And I think everybody is having to do something about this. And here I'm going back to the culture of the crisis. And the culture of the crisis is completely different. So maybe we will not look for evidences when we have the crisis. This is about kind of saving people, and that's all. So yes, scientists just come up with an early warning system that will make people move. But once we have the problem, everybody needs to do something according to a different protocol here to behave in the crisis time.
And do you find that people are more resistant because they think of it as natural?
Yeah, this is an interesting one, because by the end, if we think about, this is why I talked about psychologists and social scientists and the cognitive behavioral things. So I think we need a lot of work in this behind as well.
Okay. Yeah. Thank you. All right, last two questions, hopefully.
Hi, my name is Sara Masalha. I'm a grad student at the University of Texas at Austin. You actually kind of got ahead of me there, but my question is directed to Dr. Khomsi. So I used to live in the Middle East, and when sandstorms came through, like, you could feel it. You'll get nosebleeds, you know, headaches, all that. But one thing I was thinking of was, like, we don't have centralized filtered air in most homes there. And you talked about how, like, when it comes to dust and sand, there's not much that you can do besides mitigate or come up with, like, implementation strategies. And my question is, like, what does a realistic implementation look like to help with that?
Yeah, it needs a lot of work. I mean, scientists, again, I'm always going from an early warning system, and this is something that is important and that the National Weather Service need to have. Now, I know that the National Weather Service are excellent in forecasting the movement of winds, forecasting the dust storms, and say that we will have them, and we will have these dust storms, but definitely there is a shortness in terms of preparedness and in terms of the actions and how this plan will be implemented. However, and again, I will go back to the crisis, because the crisis that we have now with dust and sandstorms is about the increasing number and frequency of these events. And to be honest, I have never heard about this as a crisis in Morocco before this year, because we started to see it. And as long as we start to see it, we start to think about it, and we start to say, what do we really need to do? Definitely people need to sit down and talk about what kinds of mitigation plans we should have. With regards to the natural sources, there is not a lot that we can do, but with regards to anthropogenic emissions, regulations can be put. My friends talked about the control of emissions. This can be done, and that's it. Like, this is what we can do, and yeah.
Thank you so much.
Thank you. All right, quick question, if you don't mind. You've been so patient.
Gunnar Schade, Texas A&M University. I love case studies, so Dr. Ndyabakira, when you talked about the case study of Kampala with two-wheelers, two-stroke engines, large impacts on air quality, I was reminded what I learned about how this has actually at least started to be very effectively attacked, so to say, in Asia and parts of the US, namely with battery-powered two-wheelers with swappable batteries. We have an international explosion, well, not really international, mostly Asian, explosion of the usage of these. And I was interested to hear your thoughts of why or why not this is not an option in your case.
Thank you. It's just that it was not in the presentation, but it's one of the mitigation measures that we are taking to have community ownership. Remember that governments go nowhere. Just it can keep changing. The employees keep changing. So it's very important to keep your word as government. Whatever you say you want to do, you do it, so that your predecessors can find fertile ground. You deceive the community, it is always there to judge you. When you leave and some people come in, it becomes very difficult. So we implement all the mitigation measures with alternatives in mind, and our current strategy to addressing that is to convert these motorcycles into electric motorcycles. So we have a state-funded, sort of COPE, where we convert your motorcycle from, fossil fuel dependent to an electric one, and government contributes a certain amount towards that transition, and you top up, and that's happening. So that's what we are doing, because we know that we can't stop them from working. It will create another emergency. We're just transitioning them. Just for information to note, we have about 300,000 of these in the city, so it's not a one day's work.
All right. Fantastic. Please join me in thanking our esteemed panelists. You are all welcome to kind of head to your seats if you want to get off a relay. All right, as they head towards their seats, I just want to take a really fast moment to thank HEI for putting together this particular session. It really highlights an important issue. I also want to especially thank Elise and Pallavi and Eva and Jennifer Peel and Greg, who all worked hard on this. I'm just going to take a couple of minutes, I have about 3.5, really to try and tie up this session. So my goal is to think through some of the key issues that we really need to wrestle with when we think about air pollution within the context of climate change. I'm going to try and touch upon the many topics that was covered by our excellent speakers and insightful panel discussions, as well as a little bit on the draft strategic plan for HEI. So from my perspective, I think what we heard today is that, air pollution is an important issue that's being exacerbated by climate change. These exposures are very important for health, and they're in addition to and different from the air pollution exposures that we're so accustomed to thinking about, right? And so we heard, for example, about the fires, we heard about sandstorms. It wasn't talked about as much, but I think we also need to think about how climate change is going to influence secondary pollution formation. So thinking about ozone, for example, that's formed more in hot climates, and so thinking about how climate is impacting ozone. Similarly, aeroallergens, right? As the climate changes, our plants change, and thinking about how that might have implications for respiratory health. So why is it so important to think about these sort of newer, I don't know if they're newer, but less traditional sources of air pollution that come off of climate change? Again, it's because they have their own unique challenges. And we heard quite a lot about, this is hard, right? This is going to be hard work for us moving forward. As I was preparing for this session, I was thinking about the exceptional events rule that the EPA put together in 2016, where the idea made perfect sense, right? It was like, you don't want to penalize areas for these unusual and unexpected and extreme events. I think it's, not reasonably controllable and not reasonably preventable events. But as we think about it, we even heard people talk about these wildfire seasons, right? And if you live in the West Coast, you see that it's repeating. These things are coming every year. And I even read this really interesting study that estimated that for some people, half of their exposures to air pollution are actually coming from these smoke events. And so I started to ask myself, right, when do we acknowledge that air pollution from climate change is no longer unexpected, right, and an exceptional event? And how do we move forward to mitigate and adapt in an equitable way, right? We saw that policies can't be the same everywhere, that different populations have different impacts. Anyone who knows me knows I'm a pretty optimistic person. And so I like to think about the fact that, we're surrounded by great minds here, right? And we are very, creative, and we are opportunistic. And so I am hopeful and optimistic, right, that we can find a path forward. But we did hear that it's going to be hard, and we heard, that there's many different things that we need in terms of data, in terms of, integrating our efforts across communities. I really liked the one which was about making hard choices, right? I think that is for sure true here. So that was what I heard in the session. I would just like to leave by saying that I think that if we're able to really pay careful attention to equity when we design these adaptations and mitigation strategies, I really hope that we can move forward towards a healthier future for all of us. So with that, I conclude our session. Oh, yes, exactly. It's like 0 on the nose. I want to thank again the panelists, the speakers, HEI, and you all as an audience. It's really been fun to discuss climate and air pollution with you. Next up, I believe we have an exciting presentation of awards, right, by Dan and Ellen. Did I get that right? Thank you so much, everybody.